Thank you all for your time. Ron's going to probably sort of wrap it up in 1 second. But before I do that, is there anything that we didn't discuss, whether it's a population in need or, hey, someone is doing great work, that you wanted to sort of quickly alert us to so we can make sure that it's noted?
Especially if your name is Tracy.
I belong to the American Legion. And I belong to a couple of other organizations that, the Elks is another one, where as the people grow older, these organizations are dying out because the youth aren't coming in. And why aren't they coming in is the question. And what do we do to encourage them to join up and follow along those paths that were successful in the past that we grew with, with the Elks and with those sorts of organizations.
Bring back the draft.
I support that part. But no, it's important that these fellows that are coming back out of the service won't join the American Legion, for example, or the Veterans of Foreign Wars.
Because they realized that they were sent to war for not very good reasons.
That's true, but there's an organization that can commensurate with them.
Well, but that takes an individual. Having been a former reporter, etc., I know what I said before was really important. It is always that one story, like the other reporter said, keeps writing the same story over and over again. But when the story is compelling and it touches your heart, or somebody says something where you thought this never happened to someone famous, and look, it happened to Carol Burnett, it happened to this one or that one. It changes people's attitudes even that quickly. So I'm telling you, if you get kids in school to start telling their story, another kid sitting next to him is going to feel a lot better knowing that they're suffering from the same thing or they're enjoying the same thing, whatever it is. I don't mean everything has to be negative.
Yeah.
But I just believe the educational system needs to be totally redone again. And there's a big mistake going on about people's attitudes in education and a lot of other things, but it won't happen overnight, and are we going to solve it tonight? So I will say goodnight to all of you. And
I've got one other point. There is one organization in town that does bring the children along, and that's the Danish Brotherhood. The family ties are brought down, and they bring them up into the organization and grow with the organization.
But not all cultures are like
No,
that.
I understand that, but that's an indication of there's something along those lines have got to be done to bring the youth into old age with the rest of us.
You know what? Your clergy also probably have some very wonderful answers to that, because no matter what religion you may follow, there has been something about going to also a physical place that has made a great big difference in people's lives. People need to have that. I'm sorry, not everyone was meant to be a shepherd. There are just a lot of sheep out there, and the shepherds are the people like Doreen and the people like Ron Wirth, who runs a huge organization, and many other people that are sitting around this table. And that's what we have to do. We just have to do it and stop talking about it, but get it done by picking the right people to be on your school board, by picking the right executive director to run the community. But by doing all of those things, we'll get it done. It may not be in our lifetime yet, but it can get done, and we can make a difference. We should make a difference, and we will make a difference, hopefully.
Real quick,
One
item.
to say.
A data point that's necessary is demographics. And I mean, it's raw study, because the demographic in this valley over the last 10 years took a dramatic change. It went toward the people who are suffering. Families,
Older people.
families with children declined as a component representation in this valley. It's a function of land cost and value. It's a function of raw demographics that will help inform this dialogue Our church did one in 2005 that saw the population flatten and decline. Why it declined, who is represented, is an important
Yeah.
base component that needs to be in your data set
Yeah.
as you move forward. That's my point.
And if I can just say one
Please.
other. I want to echo Matt's comments about stress. I'm really glad that you mentioned that, because that is huge and so affects mental and physical health. And I think a lot of things that we talked about families and about kids and, you know, being on video games and all that. I mean, it would be good to understand what's going on in our society and our culture, why so many people are so stressed all the time. Is it because society puts a lot of expectations culturally on us that we're trying to meet, and so everybody's working, you know, a couple of jobs to buy stuff, and so then they're stressed all the time, and the kids are left alone, and so then they're playing the video games. I mean, you know, it's just a whole lot of things, but I think that, you know, putting stress in there as a part of all this is really, really
How
important.
do we deal with that?
Yeah, how we
No,
deal
that's
with
great, thanks for reinforcing that.
I think one of the things I'd like to say is, and I haven't spoke a lot, is we see this valley as one side to the other side of the valley, and we have the same problems in the entire county. We are one county, and we have to take the hillside down and just see the problems. And that is the thing I've always have seen is, I volunteer in Carpinteria, I volunteer in Santa Maria, and I live in the valley. I don't live in North County or South County, I live in this county. And I try to teach people that every day. I live in the county. I volunteer all over the place. I fundraise all over the place. That is what communities do. We don't have to just fundraise in here. We don't have, you see a need and you have to go to that need and take care of the need. And I think sometimes the need is greater in more depressed areas and up north, and we don't take care of that. And I think those are one of the big things we have to see. And we don't take care of mental health until it's at the far level. Every family, everybody has mental health issues at some point, but you cannot get into the doctor, you cannot get into the hospital for a mental health issue with your insurance. It does not matter how good or how bad your insurance is. You get 10 visits. If you have great insurance, you get 15 or 20 visits in your lifetime on that problem. If I had cancer, that is not the situation. And I think that is where the conversation has to start there. We do first aid. We don't teach mental health first aid. We don't teach mental health matters, how they do in Australia. We have to start the conversation there. And I think things will start changing because every one of these social issues goes back somehow to mental health. On the good level, on the bad level, financially, it does go to there. And I think we have to look at how, you know, who's using our services, how our services are used, and we have to do a better job teaching our population of immigrants what services are out there, and that is the definite truth. But we are one entire county. Take the hillside down, and we have to play as one. And that has always been my belief is we have to do that. And I think that's where we have to end in our healthcare tonight is we have to be one county taking care of the whole county healthcare, and looking at it as a whole, and not it's the valley problem, or it's here's a Santa Barbara problem, here's a problem over in Melpis, here's a problem that's, you know, in Santa Maria. We don't see that. We have the same problems, as we all said, whether or not how affluent the community is or not, but we have to start taking care of it because there is mental health in every single family. And we've had 2 suicides this year in our family. It's been probably the most devastating thing of our life. And we have to figure out how to address it. And I never thought that would happen in our family. I actually never thought that would truly happen. And it's been a hardship. And it happens in every family more and more than you think it does. And people are, you know, having these problems, but they go back to social issues, they go back to economic, they go back to financial, the mental health does. And I think we have to address it just like your heart, just, you know, and that's what I would like to see the hospital and the medical service do no matter what, is address mental health just like we do the heart situation. Because it is our biggest brain, it's our biggest organ in our body, and we're not addressing it.